Hey guys, it's Lexi, back at it again with another video. Today I'm going to be reading Informed Consent for Masculinizing Gender-Affirming Hormone Therapy. Basically, this means that you have to consent to treatment for hormone therapy. Specifically me, I'm going through the testosterone therapy. It also explains the side effects of the testosterone therapy, and it explains just the consent that you have to make in order to start the testosterone therapy in general. And I'm going to read most of it word for word, so bear with me here, but this is actually going to help you guys understand a little bit more and be able to think about it if you guys are actually thinking about starting your journey as a transgender, if you are a transgender. So let's get it started. Informed consent for gender-affirming hormone therapy means that your healthcare provider will explain the risks, benefits, and alternatives to taking hormones, verify that you want hormone therapy, and confirm that you understand the information in this document in starting hormones. Masculinizing gender-affirming hormone therapy is for people who are seeking masculinization of their body with testosterone. Hormone therapy is just one of the many ways to transition. It is important to talk to your healthcare provider about your goals and expectations for transitioning to make sure that hormone therapy is the right choice for you. When you have any questions about hormone therapy, now or in the future, please ask your healthcare provider. You may also decide at any time to stop taking hormones. If you are thinking about stopping hormones, please talk to your healthcare provider. Stopping hormones now does not mean that you can't restart them again later. First, and this is the part that you have to initial. First one, I wish to be treated with testosterone to help make my body more consistent with my gender identity. Second one, I understand that the long-term effects of masculinizing hormone therapy are not fully understood. There may be health risks or benefits not listed in the consent form, which we have yet to identify. I'm sorry, I'm in pain right now. I understand that the effects of masculinizing hormone therapy may take 3 or more months to become noticeable, and up to 5 or more years to have maximum effect. Everyone's rate of change is different. There is no way to predict how or how fast my body will change from hormone therapy. The right dose of hormones for me may not be the same as for someone else. Number 4. I understand that following potentially dangerous or medical side effects of testosterone, increase in the risk of developing polycythemia, a very high level of red blood cells. Rarely, if severe and untreated, polycythemia can increase my risk of stroke, heart disease, and blood clots. My provider will monitor my level of red blood cells while I take testosterone. My risk is increased by smoking tobacco. My provider can provide resources to help me quit tobacco. Increase or decrease in migraines and headaches. If I had migraines prior to starting masculinizing hormone therapy, or if I start to experience migraines, I will tell my provider. Sorry, my lighting is being weird. I don't know what's going on with it. Possible increased risk for obstructive sleep apnea, OSA, a condition that makes you stop breathing for short periods of time while you are asleep. If I have loud or snoring or worsening daytime sleepiness, I will discuss this with my provider. Improvement or worsening of pre-existing autoimmune conditions like lupus or rheumatoid arthritis, for example. If I have an autoimmune condition, I will tell my provider. Mood changes. If I experience increased depression, anxiety, or feelings of suicidality, I will tell my provider so that the clinic staff can assist in finding resources and supporting me. And then, next part that you have to initial. I understand that masculinizing hormone therapy may cause the following permanent changes: increased hair growth on face and body, hair loss on the scalp, aka male pattern baldness, deepening of the voice, enlargement of the clitoris. Number 5. I understand that masculinizing hormone therapy may cause the following reversible changes. These will change if I stop. I'm sorry, guys. I'm in a lot of chronic pain right now. Still trying to make this video. Increased acne and coarser skin. Increased sweat and body odor. Increased fat in the abdomen and or increased fat in breasts, buttocks, and thighs. Increased sex drive. Stopping of menstruation/periods. Genital dryness and or thinning of genital tissues. I understand that masculinizing hormone therapy will not change bone structure or height or make breasts go away. Next one. I understand that masculinizing hormone therapy may make it difficult or impossible to have genetically related offspring in the future. My provider has discussed with me the options for fertility preservation, such as egg freezing, embryo freezing, and ovarian tissue preservation, and I understand that this will be most effective if done prior to starting hormone therapy. I understand that hormone therapy is not birth control. While masculinizing hormone therapy, I may stop my period. It is still possible to get pregnant if I'm having sex with somebody who has sperm. I know to use some method of birth control to prevent pregnancy. Next one. I understand that testosterone is harmful to a fetus. If I want to try to become pregnant, I will stop testosterone and talk to my provider. If I were accidentally become pregnant while taking testosterone, I will stop testosterone and talk to my provider. I agree to take hormones only in the amounts prescribed by my provider. Taking hormones differently than prescribed will not make changes happen faster and may be dangerous to my health. If I am dissatisfied or concerned with my treatment, I will inform my provider. I understand that hormone therapy may make it necessary to have more health care office visits and blood tests than other people of my age in order to make sure my body is healthy while on hormone therapy. I understand that this is required to continue receiving hormone therapy. Though one community health, I will discuss with my provider how often I will need to come in for appointments and blood tests so the expectations are clear. And that is it for that. So, basically, that, like I said, that explains the side effects, that explains what to do, when to talk to your provider. Also, I did want to explain, there are 3 different ways to insert testosterone into your body. First one, the one that I'm on, is the gel. The gel can go on either your abdomen or it can go on your upper arms right up here. It really doesn't matter, but don't put it on your chest because that can cause other health issues. And then the second one is the patch. The patch just basically goes on your shoulder. You change it out once a day, and pretty much that's that. But it's very much less effective as compared to the injection and the gel. The third one is the injection. The injection I do not suggest you get if you have fears of needles, because you'd have to put it in your thigh. Probably like right here on your thigh. Basically, how you do that is you stick it, and the needle's long, and apparently it hurts, which is why I don't want to try it. But you stick it in around right here, And you can either stick it in at a 45-degree angle or at a 90-degree angle. I've been suggested to stick it in at a 45-degree angle so it doesn't hit the muscle and it won't hurt that bad, but it still does hurt. But yeah, so that is that. And if you guys have any questions, comments, or concerns, please feel free to leave those in the comment section down below. Please also feel free to like this video and subscribe to my channel. Alright guys, have a good night. Peace out.